Hi everyone.
Hello everybody. Okay, so I'm Daniel.
I'm Hafiz.
I'm Shamel.
Okay, so today, right now we have just finished our Tarawih prayers, and now we are going to be reacting to The Good Doctor, a series that I think everybody knows, and we'll be mainly reacting to some of the ethical scenarios that we have kind of like found here, and we would like to kind of discuss about it.
It's quite interesting actually.
Yeah, it is.
It's very interesting.
So yeah, let's get on with the first one.
So, what's up with Dr. Brown? She's Leah, isn't she?
Claire is my colleague.
Oh, come on. I saw the way you were looking at her.
How? I don't think I look like that.
Okay, so then why do you call her in for a consult?
Okay. Yes, she's better at talking to people than I am.
Wow, I counted like 50 tells there. You really suck at lying.
I know.
Too bad. It's an important social skill.
So how do you know when to lie?
When people need to know things, they need to know. If they don't, lie through your teeth and feel good about it.
What if they need to know the truth, but it'll hurt them?
Some can handle it, some can't.
So how do you know who can and who can't?
You tell the truth. If they like you after, then you'll know. If they don't, then it doesn't really matter anyway.
You have cancer.
Yeah. I know.
For the scene one, the main topic is lie, and it is portrayed for confidentiality, ethical values.
So I'll be kind of like explaining about the scene again. Okay, so just to give us a kind of like overview of what's actually happening in the scene. So based on this scene is that the little boy was diagnosed with cancer, and as the guardians, the parents decided to not actually inform the patient that, their child, that he has cancer, and also actually told the other doctors to refrain themselves from actually informing the patient he has cancer. But despite being told not to, Dr. Murphy, as we know how he is, actually just told the patient directly that he has cancer. So how do you think about this?
I think. Hafiz, do you have any opinion about this situation, or do you think it is ethical for Dr. Murphy to tell the patient or the boy that he had cancer?
So when you formulate the question like that, I guess how do you say this? This is actually depending on the situation. Let's say let's discuss on the norm itself. Currently, kids cannot
They cannot really make their own decisions.
yeah, they cannot really do their own decisions. Meaning that in terms of signature stuff, they can't really liaise the papers. Let's say in order to go to a specific procedures and whatnot, especially in the hospitals. Maybe because we believe that kids don't have the cognitive state of mind yet. They are not mature, they are not able to think and process wisely. Let's say if I ask my little brother about cancer, I don't really I'm positive that he don't know what cancer is. Maybe he could laugh about it or something.
I think some people know, some people don't.
Yeah, maybe lah. So that one is based on the norm. But then when we talk about this scene itself, it seems like the kid knows what he is dealing with. He read about it. He knows.
He Google it.
Yeah.
He make research about it.
Exactly. So and we can see that the kid is quite calm, able to perceive the information well. So in this patient, we don't really see the child being screamed like, "Oh my god, I'm going to die" or something. So I don't think this is a huge deal lah.
You think it is ethical for Dr. Murphy to tell the patient?
For Dr. Murphy in this scene, yes. I don't really see
In this
much-
situation, you think it is okay?
Yeah, because the kid himself
Handle it
asked,
well. Yeah.
he asked the question himself. He is eager to know.
Personally, I think that as you just mentioned, he is stable and able to think maturely. I think he is the one who is going to face and bear the cancer for the rest of his life.
So he should know.
He should know. Yes, he should know. He is the one who is going to take any prevention for not making the disease any worsen or any bad. You know, you get it right?
I get what you want to,
So, on the other hand, if he knows about how percentage of how he is going to make his quality of life better, so it will increase his motivation to live longer and to live a better life.
Yeah, at least he is able to like how do you say this? Enjoy life.
Better, right?
Better.
Yes. And then you can conclude this, I think.
So yeah, based on what you guys have already explained so far, I think we can all agree that it is not actually wrong that Dr. Murphy informed the patient himself that he has that particular disease to anybody, despite this being a minor or anything, because in the end of the day, regardless of age, that patient himself or herself will be the one facing the disease on their own. That was one of the highlights from Shamil, and so maybe there will be disagreements afterwards. I think we can remember that afterwards there was an argument with the parents when they found out that the child knows about it. The child can actually make his own decision because he is mature enough to even actually Google about it and not freak out, because even myself, when I Google about my own symptoms, I would freak out as a medical student, and so yeah.
It's always the worst things.
Yeah, they're always talking about the worst things.
Even if it's just a common cold.
Yeah. So even though he knows he has cancer, he felt that he has cancer based on all the symptoms, he's very calm about it. So yeah, I think we can just go on to the next scene.
Okay, sure. Let's move to the next scene.
All right. So scene 2.
We should drop off this agreement with our deposit check tomorrow. Once I explain the issue to the pastor, I'm sure he will replace the problematic floorboards.
Johnny, there's something I really need to tell you.
Stop!
I'm gonna call 911.
Hello, I'm Dr. Sean Murphy. Where are you hurt?
It's my hand.
Your fourth and fifth fingers are broken. If you have no other injuries...
Sean! Over here!
Hello, I'm Dr. Sean Murphy. Are you injured?
My leg's trapped. My chest hurts when I breathe.
How far along is your pregnancy?
26 weeks. Do you think my baby's okay?
I have no way of knowing.
Oh!
But you have tachycardia and your jugular is distended, which are signs of a cardiac tamponade. If I don't drain it, you'll die before the paramedics arrive.
What's your name?
Alma?
Alma, hi, I'm Leah. Is there anyone you need me to call?
No, my boyfriend's out of town. What are you gonna do with that?
Subxiphoid pericardiocentesis. An echo-guided one would be better, but I don't have a J-tipped wire or an echo machine.
Maybe we should wait for the paramedics.
Alma, you can trust him.
Oh, my chest is exploding.
Okay, hold. You are very lucky. We usually don't drive to work this way.
Okay, so scene 2. This one is actually a scene when Dr. Murphy and his friend actually arrived at the a car accident. And yeah, so I think maybe Hafiz can actually explain about it.
Yeah, sure. So, if like we just saw the video, right? So, Dr. Murphy and there's this one girl. I'm not sure about the character lah, but then they were inside the car. Then apparently, they witnessed a car crash. So Dr. Murphy as a doctor, I'm not sure if it's correlates with his autistic or something. He feels the need to help the guy on spot. So obviously he would go to the nearest patient. First he noticed that the patient was a male, a guy who was driving the truck. He had broken fingers, but then soon afterwards the girl who was with him called him to go to the other car. Apparently when he arrived to the scene, he saw that there was a pregnant female. I'm not sure how long her pregnancy is, but then he had a few symptoms. We concerned about her being pregnant, and then we know that his jugular vein was dilated. As we know, Dr. Murphy being superior in terms of medical scenes, he suspected the girl to have cardiac tamponade. And we can see a few scenes where he did a few procedures, emergency procedures. So those are basically the overview of the scene. What do you guys think?
So I think we're gonna start off with how he approached the patients. So we all know that the first patient he approached was the male driver who has broken fingers. That was the first person he saw, so it was obvious that he approached that guy first and attempted to actually heal that person. But before he even was able to actually do something, his friend earlier, who was driving for him, called him because she found a pregnant lady stuck in her car and was having, as we just concluded, she has cardiac tamponade. And so without even thinking twice, Dr. Murphy did not actually attend to the guy, but directly attended to the girl herself. So in this situation, we can see how he actually did a very good ethical decision where he upholded the justice value, where he treated the person who was in need at that moment first. Because if we're trying to compare someone who has a broken finger or someone who has a cardiac tamponade and could die in the next few minutes, of course he would treat the person with the more emergency kind of scenario first. And so that's actually very good of him. So how about you? What do you see about this scene?
This scene, I can also extract one more ethical value, that is beneficence. He chose to attend to the patient with a limited resource, with limited equipment, with DIY equipment. We can see he used bottles with what kind of holes, pump. With that limited resource, he chose to, with the risk of infection, with the risk of bleeding, without knowing where actually the jugular vein or whatsoever, what kind of cardiac tamponade, where or whatsoever. Okay, and then with that possibility, he chose to do that. He take the risk to save his life, to save her life.
Who wonders 5 minutes craft are able to save someone's life?
Yes. Life over everything.
So I guess we can see that from this one scene itself, there are two ethical values which correlates to justice itself. From your point of view, he chose to be justice and not treat everyone equally, because he knows that the woman was facing a huge risk of dying. And your point was he was able to think. He was able to act in a good manner, in which he focused on saving the patient's life first.
Yes. That's what I'm to complete.
I
Actually,
see.
thank you, Hafiz.
I see.
Good.
I
Thank
see.
you, Hafiz.
See. Okay, so I think yeah, this is all that we can actually do for these. Actually, have a discussion about for these two scenes, and I hope that everybody enjoyed it. We actually really enjoyed watching it as well. So yeah, see y'all next time.
Be a good doctor.
Yeah.
Be a good doctor.
Good doctor, sorry, no camera.